friends. We have been having a study on materia medica and we have been dealing with homeopathic remedy Spongia tosta. And in this course of discussion and study of this particular remedy, we have reached to the Part-7.B, current clinical correlation. I would like to remind that at this moment the text is being taken up from Allen's keynote, and this is a very good study for BHMS students, interns, house physicians, MD students and practitioners at large. I am Dr. V.K. Chauhan. So friends, before we go to this particular section, we have to have something in our mind, means we need to have a background. From that background point of view, we have to understand this particular text. Kent, Allen and other writers, whatever they write, they have a perspective. And that perspective includes not only homeopathic materia medica. Since materia medica is an applied science, so you need to have side by side understanding of medicine also. So we can have a good perception of what the author is telling us, to read in between the line, to understand the intentions of the author to provide you that particular text is important. And it differs person to person because we have different level of understanding, studies and exposure in life. So no two teachers are alike. However, you have to listen to everyone so you can have a very mature outlook towards the medicine. I would like to propose that whatever the materia medica is written, it imbibes at three levels of perception of the disease stages. Primary presentation, where the patient is there, constitution is there and susceptibility is there. So we have already studied, while studying this materia medica part of Spongia tosta, that what is the constitution of this particular, and constitution shows the miasmatic background, that is the core area of susceptibility, or you can say once the patient becomes susceptible due to environmental causes, exciting causes, he has a diathesis, he will produce a particular set of symptoms. So stage of susceptibility we have already gone through. Now we are dealing with the second part of this remedy, which is the clinical presentation, means symptomatology, where we have to use it in terms of applied materia medica. It has got two broad areas. When the disease starts, pathological changes do start. They are in the seed form, in the seed form in your constitutional weakness, which we call as miasms. So these miasms get activated, whatever may be the reason. Once they are getting activated, the disease is at subclinical level, because if you have to go for a nomenclature of the disease, so there will be certain sign and symptoms. And sign and symptoms will have some biomarkers, but these biomarkers are usually seen in cases of organic disease. In psychiatric problems, we have a diagnostic set of symptoms which form a constellation which is being given as a standard diagnostic guidelines in DSM-4 and ICD-11. DSM-5 nowadays we are applying. So when we talk about organic diseases here, what we are going to see in the stage of subclinical stages, there will be investigations may be positive, biomarkers may be positive, but symptoms are not there. And by the time symptoms produced, stage of clinical disease is there, everybody is able to diagnose it and you can recognize it in the form of disease. Like if you are talking about the cough of Spongia, you say yes, this is the Spongia cough. What is the disease? You may be able to diagnose it is a bronchial asthma, or it is a croup, or it is a whooping cough. That particular stage you become very familiar with the disease presentation, but a lot of time is gone. You have missed the bus where the pathology started, where you could have taken care of and prevented the disease from developing further. However, at this particular stage also, if you are not been able to contain the disease will go to the stage of irreversible stage of organic changes where disability and death is imminent. So in the medical management system, we have 3-4 areas where we should be very careful. Number one area, study area, where we study the constitution, that is elements from characteristic generals that defines the client characteristic. Here your miasm is very prominent and miasm is at dormant stage. So here if you want to strengthen the constitution, but if you find no symptoms, only miasmatic traits are present, please give deep acting anti-miasmatic remedy, so it is going to keep that miasm in latency. However, if it gets activated and you find there are early changes are going to take place, if you have that particular eye, you will give the constitutional medicine. You will give the constitutional medicine. There is no sign symptom, but if you are keen, you know the modern medicine, you know how to investigate, you know how to diagnose, and you know how to understand that this particular patient, if not treated at this moment, will develop into the frank sign and symptom. That is the crucial period where disease is totally curable. This is a window period, asymptomatic stage, early stage. Disease is total curable, but if the stage of clinical disease comes, you have the cure, but some sort of tissue changes will remain, which will be a weak point. And at this particular point, you will find signs, symptoms are there, investigations are there, and you can have the specific medicine. Symptomatic indication will also be there. So it is a very specific indication of that medicine you will find. And ultimately, if you see the progress of the disease, then pathology will be irreversible, and here the doses will be pathological doses. Mother tincture doses will be more suitable, more frequent repetition is suitable, but in a stage of clinical disease, maybe 6, 12, 30, 200, 1 million, whatever potency you think, you can prescribe repeatedly according to the demand of the time. So with this background information, we would like to move ahead and let us go to the next point. Here we are going to deal with characteristic general symptom PQR6, worse after sleep or sleeps into aggravation. This is a general symptom, but it has got certain specific areas where you will find patient who has this kind of a presentation, why he finds difficulty after sleeping or he sleeps into aggravation. It just means that the patient goes into sleep feeling better, but he thereafter wakes up feeling worse. So Spongia has got this particular symptom because of most probably dry cough. If you are talking about Spongia, it is dry barking cough which wakes him up, suffocative attacks which wakes him up, respiratory distress and tightness, anxiety of breathlessness that he is going to suffocate, and dryness of throat and larynx, and sudden panic. All that contributes to aggravation in sleep. The patient sleeps into the aggravation. The worsening happens while they sleep or immediately before waking or after waking. It has got a deeper meaning. That is a superficial meaning what we have understood. But then please remember, sleep itself draws the patient into attack of aggravation. The moment they fall asleep, larynx constricts. There is a spasm. The airways becomes narrow. There is also a spasm. Mucus dries further and the spasm increases. Anxiety shoots up and they wake up with in a kind of a anxious position where they are grasping for breath and they are suffocating. This is typical of croup, laryngeal spasm, and tracheal stenosis. Maybe because of sometimes whenever you are upright, probably this pressure is not much because of enlarged thyroid gland. But if you sleep, probably it falls back on the thyroid gland and there can be a pressure effect. So Spongia's main sphere is here in the larynx. So we have to compare here lachesis and Spongia. So features of Spongia and lachesis you will find as under. The main issue is for Spongia dryness and constriction of the laryngeal area or upper respiratory tract. And here you will find congestion in circulation. Lachesis has got congestion in circulation. And breath is tight, narrow, wooden pipe breath in case of Spongia, but you will find suffocation from congestive affection of the heart and lung in lachesis. After sleep, there is a spasm of larynx in Spongia, but in lachesis, circulatory aggravation is there. And then we go to the next point, which is wakes up. Here, Spongia wakes up grasping, coughing, and lachesis wakes up choking, cannot bear tight clothes. Cough is barking in nature for Spongia, and you will find dry, tickling, strangulation in case of lachesis. So friends, let us go to the second characteristic symptom, which is PQR3, swelling and induration of glands, especially goiter, and PQR8, thyroid gland swollen, even with chin, with suffocative paroxysms at night, and PQR9 tells us only about goiter. So these three PQRs are having central idea, which is goiter or thyroid enlargement. So they need to be taken up together, all together. So here what we find, swelling and induration of the gland, goiter. We are dealing with PQR9. What we find, the features here, they simply tell us most probably towards the colloid goiter. And this is a deficiency goiter. And sometimes there are people who are taking certain foods, goitrogenic foods, which will not allow the iodine to be get absorbed, like cabbage, millet, soya. Then endemic areas where people are living like Himalayan belt. Physiologically, you will find pregnancy and puberty is the common time when this kind of goiter or thyroid enlargement occurs. Clinically, you will find diffusely enlarged goiter, and mostly the condition is asymptomatic, and pressure symptoms, dysphagia, hoarseness, can only occur if it is a very massive enlargement and presses upon the trachea, esophagus, and recurrent laryngeal nerve. And thyroid function is normal T3, T4, TSH or slightly high TSH. So this is a euthyroid stage. There can be some other possibility of thyroiditis, acute thyroiditis, which is a kind of a inflammation of thyroid tissue. It can be post-viral, viral, and painful thyroid enlargement will be there. There can be local heat, pain, tenderness, and redness. Pain may radiate to jaw, ear, and throat. There can be fever, malaise, lassitude, And if you feel the gland, thyroid gland, it will be tender to touch, and there is a momentary, or you can say transient hyperthyroid phase. As the swelling takes place in the thyroid gland, the thyroxine leaks into the systematic circulation and BMR goes up, so pulse will be high and other features of thyrotoxicosis will be available to be seen clinically. So what are the diagnostic clues? We have ESR is very high and T3, T4 is high initially, but then as the disease subsides, they will fall down to normal. So it is an acute condition. Now, there can be a chronic condition which is generally we know as Hashimoto thyroiditis. And here the key features are the thyroid gland is enlarged, it is a painless rubbery gland, and the usual cause is autoimmune disorder. So there are antibodies against the thyroid gland, so they cause destruction over there, and there is a chronic inflammation. The gland may be diffusely enlarged, but please remember, after some time, as the attacks repeatedly go into remission and relapse, ultimately patient will have, initially during the acute phase they will show the features of thyrotoxicosis, but as the autoimmune disease goes into the remission, you will find the patient recovers and all functions come normal. But on repeated attacks, remission and relapses, ultimately gland will become fibrosed and patient will develop true hypothyroid stage. Many of the homeopathic doctors who treat the hyperthyroidism or hypothyroidism at times belong to this category, and initially they show very good response to homeopathic medicine, but they need to be watched for a very long duration of time. It is a chronic disease. Let us not be very happy that you have cured the disease. Don't jump to cure. Cure in chronic disease is not generally seen. It is a progressive disease. All chronic diseases are progressive. You can stabilize them for some time. You can put them in remission for some time. But nevertheless, here and there, certain exciting causes will tell, you will find that the disease will come back. So you need to be quite mature while you claim, I have cured this and that. Hypothyroid symptoms will be weight gain, cold intolerance, constipation, and diagnostic clues are that very high TPO levels will be there, and TSH is high, T3, T4 is low. That is a classical feature investigatively. So let us go for a one-line recall to all this. Number one, colloid goiter is painless, iodine deficiency, normal function. Number two, acute thyroiditis is painful, post-viral, hyper or hypothyroid phases will be seen there, and Hashimoto is a painless autoimmune thyroiditis. It ultimately going to end into hypothyroid. So friends, we go to the PQR 8, and the 8th line or 8th sentence in the Allen's keynote tells us, thyroid gland swollen even with suffocative paroxysms at night. So here we are talking about the pressure effect of the enlarged thyroid gland, that is colloid thyroid gland. It is a very massive enlargement and it involves the whole neck region. What such thyroid large enlargement causes? It causes mechanical pressure on windpipe, causing difficulty in breathing. If it is in the recurrent laryngeal nerve, you will have changes in the voice, and if it is in the esophagus, very common feature will be dysphagia or difficulty in swallowing. Sometimes there can be venous return is also affected. So there is a congestive choking while the patient lies down. The center of gravity is no more upright. If you have the gravity upright when you are standing, the venous return will be aided by your gravitational force, but that advantage goes away when you lie down. So patient has got aggravation while lying down. And then why suffocative paroxysms at night? Because at night the patient lies supine, the enlarged thyroid gland falls back, it compresses more on trachea, it also reduces the laryngeal aperture. You can say laryngeal stenosis. It is not true stenosis at the moment, but dryness increases and barking cough and panic occurs because of this particular respiratory distress. Now, the other features we have to keep in mind, huge multinodular goiter can have something similar, some features, but please remember substernal goiter which compresses the trachea, which may not be visible in the neck region, but you have to examine it. And massive colloid goiter, of course, that is usually seen. Tracheomalacia due to the compression is important after effect, and thyroid pushing the larynx backward will cause a stridor, difficulty in breathing and cough. Now friends, let us go to PQR7, sore throat, worse after eating sweet things. So it is a characteristic particular general, and that too also internal throat. So here we have the features like why does it happen so that sweet aggravates the cough? Sweet specifically is a sugar rich food and it causes increased viscosity of the mucus, making throat dryness worse. And then local fermentation occurs because you have the sweet in the mouth and throat. Mild irritation of pharyngeal mucosa occurs because there is a local fermentation. Carbohydrates they ferment fast. And then increased glycemic load produces internal heat and aggravates Spongia's dry heat sensitivity. And this is a possible explanation. I do not say this is the only explanation. We are exploring different ways to understand why it happens like this. In case of allergic mucosal reactivity, because the patient is having tubercular diathesis and the core feature is a tubercular constitution, and such tubercular traits are sugar reactive, there is minor stasis which causes irritation in the throat region and upper GI region, and it causes reflex cough and soreness. When situations where modality helps, like children with croup, especially you have to think who is your target client, and especially here children are the good client who have croup after sweets, sudden barking cough, and there is soreness of throat. We may have chronic pharyngitis where we will find dryness and stitching after sweet foods. And then tubercular diathesis tells us that there is a natural predisposition for such patients to have sweets. They will trigger mucosal irritation and dryness. Now, thyroid pressure on trachea can also make the patient feel raw, sore throat, aggravated by foods that create internal heat like sweets. We can have a small differential diagnosis for homeopathic remedies, and we have the homeopathic remedies argentum nitricum. Here sweet causes diarrhea but not the sore throat. In case of sulfur, sweet aggravates digestion but not throat. Throat is a very less typical kind of a finding here. And beta carb, which aggravates by sweets because of tonsillitis but glands are enlarged. And Spongia is the medicine where dry, sore, scrapped throat, worse sweet is much more characteristic here. So friends, let us go to the next slide, and here we find the EPQR based clinical analysis. E stands here for etiology, and etiology is tubercular diathesis with mucosal hyperreactivity. Sweets generate internal heat and causes viscosity of mucus and provoke the cough irritation in already sensitive pharyngeal tissues. And second possibility here we have P stands for particulars, and very specific particular symptoms is sore, raw, scrapped throat immediately after sweets. Patient complains गला जलता है, चीज खाते ही जलन और ड्रेड बढ़ जाती है, स्वीट डिश खाते ही या मीठा खाते ही तकलीफ बढ़ जाती है. ड्राइनेस इंक्रीजेस, scratchy feeling becomes more, tight throat sensation is there, and which brings about the dry cough. Q stands qualities, and qualities are the cough is dry, rough, burning, soreness, feeling as if mucosa is scraped with sandpaper. There is tightness, as if the throat is narrowing. Cough may return with barking quality. And R stands for rareness, very rare symptom. What is that? Sweet aggravates. Sore throat is not common across throat remedies. This makes it a very highly characteristic for Spongia patient, and Spongia as a remedy. Few remedies have sweet aggravated sore symptoms in clean confirmatory form. Well friends, we go to now respiratory system, and here we have PQR4. Awakens in fright and feels as if suffocating, as if had to breathe through a sponge. And let us analyze this particular symptom. Here we find that it points to two very characteristic Spongia experiences. Number one is awakens in fright and grasping. The patient suddenly wakes up terrified, struggling to breathe, grasping the throat and chest. It is not just simple dyspnea, it is a panic suffocation together. And breathing through a sponge, that characteristic thing, a classical sensation, it denotes that air does not pass freely, like inhaling through thick, porous, dry medium, and breathing feels hard and obstructed and dry. There is a sense of blocked airway, yet without mucus. Very dry respiratory tract is there. This is opposite the hip herself, where we have got wet rattling or like antimonium tart. Mucus cannot be expectorated, but it is something very very different here. Let us try to clinically understand it, or our interpretation here. It speaks like this symptom matches conditions where dry airway narrowing occurs. There is a kind of spasm in the respiratory tract, in the trachea, in the bronchi, in the bronchioles, and most possible correlation can be subacute laryngotracheitis, where you will find dry croup and spasmodic croup in children's, and then laryngospasm is one more condition, or tracheal stenosis can be one of the important reasons, and then last but not the least, nocturnal asthma is very very important in case of children's. Paroxysmal nocturnal dyspnea is very uncommon thing, but then that should be thought in cases of elderly person, maybe having respiratory dryness, but paroxysmal nocturnal dyspnea is a symptom of cardiac failure, and cardiac failure patient may have many conditions because elderly person may have diabetes, hypertension, coronary artery disease, valvular heart disease, or car pulmonale. So congestive cardiac failure, this particular symptom needs to be clearly evaluated, examined and verified because this has got a very serious significance. It is not we have found the totality and we are happy prescribing Spongia. It doesn't end there. You need to thoroughly investigate and diagnose. It can be sleep apnea also. So friends, we go to PQR5 in the respiratory system. Sorry, and but then this symptom is very funny symptom. It has got two components. Mental excitement increases the cough. So truly speaking, it is something mental general also, and its effect, concomitant symptom or comorbidity associated with this is specifically the cough. So let us try to examine this particular peculiar symptom in Spongia tosta. The mind and respiratory systems are very very intensely linked structures we have. Whenever the patient experiences any kind of sudden joy, fear, anxiety, worry, or shock, or excitement, you will find, or anticipatory anxiety is there, it immediately provokes the cough. It becomes worse, more frequent, more intense, or more spasmodic. It makes it characteristic modality not common to many cough remedies what you will come across. And our clinical interpretation, we try to understand it. Anxiety causes vagus stimulation leads to stimulate the cough, and this rubric matches psychogenic trigger of laryngeal irritation, precipitating laryngeal hyperactivity as we see in laryngitis. Associated with laryngitis, tracheitis, post-viral cough, spasmodic cough, and GERD, gastroesophageal reflex disorder, where we find this kind of a feature also. And stress-induced bronchospasm is very very common presentation, and in some children's or the patients parents who are anxious, they transmit the anxiety to the children, and children develop cough. But please remember one thing, spongia is dry, tight, constricted, no mucus. Please remember once again. Friends, again we go to the PQR10, and there is a respiratory symptom, great dryness of mucous membrane of air passages, throat. So upper respiratory tract is nasopharynx, oropharynx, laryngopharynx, trachea, bronchi, bronchioles, segmental bronchioles, and then we have alveoli. Here this tract is dry as horn, just like a horn, what that expression has been given by old masters. So this is a very description is a hallmark keynote of Spongia tosta. where extreme dryness of every part of respiratory tract is there, whether it is a throat, larynx, trachea, bronchi, or bronchioles. Dry as horn, usual expression by old masters, because the horn is hard, rigid, moistureless, exactly how the spongia patient airway feels. This single sensation can lead to spongia. If you think carefully, you need not think much. It is a very direct, only possible medicine which will come to your mind even without other symptoms. So clinical interpretation is this dryness matches the subacute laryngitis, tracheitis, where dryness precedes the inflammation. Particular phase you have to remember. Early croup, dry, barking, sawing, cough of spongia is classical. Post-viral airway irritation is another possibility where mucus hasn't formed yet. The mucous membrane is still dry. Chronic dry bronchitis with scanty or absent expectorations, and then allergic dry cough, airway hypersensitivity with dryness, no rattling, no gurgling, no moisture, all dry. Friends, we go to the next PQR, which is 11. Cough, dry, barking, croupy, rasping, ringing, wheezing, whistling, everything is perfectly dry. No mucus rel. So whatever type of cough they have experiences without mucus in the respiratory tract, everything has been described here. So entire respiratory airway feels like a rigid dry tube producing barking cough, rasping cough, ringing, whooping, whistling, wheezing sound that generally seen in bronchial asthma what you find. And this cough is so dry that and tight that teachers described it as raw, a saw going through rawed, barking like a seal. And clinically, we may find similar symptoms in a spasmodic group where cough is dry, hoarse, barking, worse at night, especially it is worse before midnight. I think it is not after midnight. It is a very rapid onset, better by warm drinks and steam. Laryngotracheitis, one more condition where you will find similar features. Here the dry harsh cough is there and larynx is painful, hoarseness and tightness is very characteristic. And also you will find similar symptom where you get early asthma or bronchial spasm where the airway is dry. And another condition, possible condition you may encounter is a post-viral dry cough where mucus secretions are still not started. Friends, let us go to the next PQR. It also belongs to the respiratory. So there is a big constellation of symptoms which are dedicated in spongia to respiratory system. So we can understand it has got cough and respiratory systems are very marked. Glandular thyroid is very much marked, and third structure which was here was your testicular affections were marked. These are the three main areas where Spongia tosta is very important remedy, and we are following respiratory system here. And next constellation comes from PQR 12, cough dry sibilant like a saw driven through a pine wood, worse sweet cold drinks, smoking, lying with head low, dry cold winds, and aggravated by reading, singing, talking, swallowing, better by eating or drinking warm drinks or warm things. So friends, The dry sibilant cough, where we find no mucus, no expectoration. Sibilant is hissing, whistling sound, and it points to the narrow airway, dry mucous membrane, and vibration of tense tissue. And second expression, which was like a saw driven through a pine board, this is a metaphor for sound sensation. Sound is harsh, rasping, grating, metallic, and sensation is a scraping internally, rawness, distress, tension of the trachea. And this is very diagnostic of spongia. It is a roughest cuff in the materia medica which belongs to spongia. Modalities are very important. Worse from sweets, sugar irritates the already dry larynx or pharynx and causes reflex cough. We have cold drinks, cold causes a spasm of trachea and instantaneously there is a cough. Smoking, that also causes local heat, dryness and irritation, which irritation causes violent increase of cough. Lying with head low, then what happens? The blood pools around, congestion takes place, tightens the already dry laryngeal tissue, choking occurs because thyroid is already enlarged over there. Then dry cold wind is also very great instrumental in increasing the cough. It irritates the dry airways, causing dry barking cough. Reading, singing, talking, swallowing also aggravates. These involve laryngeal movement, which rubs irritated vocal cords and they provoke cough. This connects spongia to teachers, speakers, singers, public speakers, or children with croup. Now, we still go ahead with modalities extremely important for spongia. Better from eating food, moistures lubricates the dry air passage, temporarily provides the relief in cough, and then warm drinks, they relaxes the spasm, loosen the dryness, softens the membrane, and gives marked relief. This is one of the strongest modalities for spongia. It, if the warm drinks relieve the cough, always consider spongia. We'll go for clinical interpretation. This perfectly fits to spasmodic cough where we have dry, barking, sawing, sudden attacks which is worse by cold wind and excitement. Laryngotracheitis is a viral condition generally in small children, kids, maybe 1 year to 3 years old, strong irritation, hoarse cough, hoarseness is marked. Tracheitis and laryngeal spasm is one more important thing which we have to keep in mind. Severe irritation of the trachea but no mucus. Post-viral hyperactivity of airways is also important. Airways they become dry, sensitive and raw. Early asthma with dryness where we find wheezing, dryness and spasm. The absence of mucus differentiates spongia from hypersulf, antimonium tart and epicock. Friends, we are still in the respiratory system and PQR13. Here the distinct condition is talked about croup, anxious wheezing worse during inspiration and worse during expiration is aconite. Worse before midnight, please remember cough of spongia is worse before midnight and worse before morning is hypersulf. So let us go ahead. Spongia croup is anxious, wheezing, worse during inspiration, worse before midnight, and it is being contrasted with aconite croup worse during expiration, hypersulf worse during morning hours, and this is a very important comparative PQR for acute croup cases. Clinically speaking, Spongia corresponds to spasmodic croup. Dry barking better with warm steam. Attacks often occur before midnight. Very dry larynx and trachea. Wheezing, inspiration. Wheezing expiration is very marked also. Stridor during inspiration. No mucus at early stages. Viral laryngotracheitis. Dry stage. Early airway obstruction from dry inflammation. So these are the possible conditions we find. Let us go to the croup as a very specific condition. It is an upper airway respiratory disease. Please remember, croup is a acute disease and it is a disease of upper respiratory tract. It is caused by parainfluenza virus which leads to a swelling in the larynx and trachea, which results in respiratory distress associated with distinctive seal-like barking cough. And here these particular diagrams, they show how the normal trachea is, or normal windpipe is there, and normal larynx is there. Uppermost diagram shows the larynx, and this is the vocalis muscle, and there is a rima glottis, the aperture. This is the narrowest point in the respiratory tract, and in the second diagram, upper one, you will find there is a acute swelling altogether which is involving the larynx, and it is causing stenosis at this particular point where it is a difficult area for air to pass, whether it inspiration or expiration. Even inspiration being a very active phenomena, it has got lot of difficulty. And inside the trachea, you can see here there is a mucous membrane which is having a lot of swelling, so it causes a stenosis, and it is a cause of a typical cough in kids group. This is a radiological feature we can find here, and this particular airway stenosis area showed here is known as steeple sign. Friends, the etiology I will remind you again for croup is the age is 6 months to 3 years and peak age is 2 years. Sex, we will find males suffer slightly more. The weather, which is predisposing, act as a predisposing factor towards the cold months of September to December. The cause, as you know, is a parainfluenza virus, and spread is by airborne contagious airborne infection which is very contagious in nature. So symptoms, they are sudden seal-like barking cough which is worse at night, fast breathing, there is a stridor, high-pitched musical sound or breath sound caused by narrowing of larynx and trachea. So there can be following clinical types. Number one is a mild, where seal-like barking cough is there, and if it is a slightly moderate kind of a presentation, you will find seal-like barking cough with stridor and sternal recession in drawing of the chest at rest while inspiration. And then we have severe, where we will have third symptom, agitation or lethargy. Cyanosis is common, and this is a very serious state of affair. If you find the child has got this kind of a presentation, he needs to be treated in the hospital setup. Please remember the duration of the course of this particular disease could be 7 days. Initially, you will find it starts as common cold symptoms for 48 hours, and thereafter suddenly you will find symptoms of croup, they come up. So friends, let us go to the next PQR. We have finished up with the constellation of respiratory system PQRs. We are going to the first PQR 14 related to severe palpitation violent with pain and grasping respiration. Awakened suddenly after midnight with suffocation and great anxiety. Valvular insufficiency before and during menses. So it has got multiple components. Let us see. Palpitation is there. Pain is there. Respiratory distress is there. Worse at midnight is there. Anxiety is there. Valvular insufficiency is there. So this small sentence includes multiple problems. Multiple problems. The heart beats loudly, rapidly, forcefully. So it is a kind of a pulse which is very jerky kind of a heartbeat is there, very violent heartbeat is there, pulse may be hammering kind of a pulse is known as water hammer pulse, generally seen as aortic regurgitation probably associated with pain and grasping respiration. Pain could be angina. It is heart associated symptoms, so we take it up as a pain which is related to cardiovascular system. And grasping respiration is because whenever the heart failure starts, it has got backward pressure in the lungs is congested, once the lungs are congested, there is a difficulty in respiration, it compromises with your respiration system. The heart activity and breathing are highly linked. Palpitation causes breathlessness causes panic causes worse, the palpitation becomes worse, and this cycle is central to spongia. Then patient awakens suddenly after midnight. Please remember, cardiovascular system disorders, whatever may be associated with spongia, as a remedy, they are after midnight. Cough symptoms are before midnight, and after midnight the symptoms of cardiovascular system is suffocation and great anxiety. And why they are there? It is a valvular insufficiency. It is not a primary disease. In the young age group, you will find when the constitution is there, they are susceptible. They are susceptible to upper respiratory tract infection, streptococcal throat infection, and then they go into the secondary reactive phenomena where they have rheumatic heart disease, pericarditis, endocarditis, myocarditis. So valves are involved. By the time valves are involved and you become adult, these valves they get calcified, and calcified valve which are rigid initially predominantly they cause stenosis, but later on there is a regurgitation. So here the Alan tells us that here we have spongiatosta having valvular insufficiency. So valvular insufficiency, the primary presentation was in the susceptible stage. Secondary presentation is during the adult system when they have got this particular asymptomatic phase when the heart was compensating, and valvular insufficiency occurs when decompensation starts, then these symptoms are coming. So you are examining not the secondary symptoms or secondary presentation of the disease, but tertiary presentation of the disease. Organic cause is very marked here. So Spongia is one of the few homeopathic remedies which has got action on the cardiac valves, and so it is useful in valvular heart disease. It may be a mitral regurgitation, aortic regurgitation, tricuspid regurgitation, and palpitation before and during menses. Why? Because there is a fluid retention in this particular phase which causes cardiac load, increase in the cardiac load, and the cardiac load increases and precipitates failure, so symptoms increase. So let us go to the very next Explanation of PQR14 palpitation violent. The symptoms can be associated with panic associated paroxysmal nocturnal dyspnea. It may not be a classical heart failure, but fear plus anxiety which causes constriction of the respiratory tract. Valvular heart disease, of course, it is very clearly spelled by the author itself, and hormonal sensitive palpitation premenstrual phase is characteristic, and sympathetic overload status when the anxiety and cardiac irritability they are having interrelation, they irritate each other. Both of them are very commonly associated with at a one particular given time. Then paroxysmal nocturnal dyspnea is an episode of tachycardia, choking sensation, which is often mistaken for asthma. Friends, we go to the CVS PQR15. Angina pectoris, contracting pain, heat, faintness, suffocation, anxiety and sweat, worse after midnight. This is a classical presentation of Spongia, and let us try to examine it. What we find here is it is a Spongia's cardiac crisis picture. Angina is tight, squeezed, compressed, constriction, that kind of a feeling is there. And then cardiac strain, sympathetic overactivity, reduced venous return, momentary circulatory collapse, all that contributes because of valvular heart disease, suffocation and anxiety. It's chest pain, breathing difficulty which leads to intense fear, and sweating is a common feature because of sympathetic hyperactivity stage where we have got angina. The cold sweat, pallor is very marked, but it is a serious thing which needs to keep in mind. If the pain is more than 5 minutes, it is unstable angina. Why worse after midnight? Because parasympathetic dominance occurs at night, low cortisol level, reduced airway diameter. These are few of the contributing natural causes are there. Clinically, this rubric corresponds to nocturnal angina, especially vasospastic, prismental angina or stress-related episode. Then we have another condition, panic associated pseudoangina, where anxiety, dryness and airway constriction, they mimic altogether as a cardiac ischemia. Friends, sympathetic overdrive episodes can be seen in hyperthyroid state where we have maybe anemia or hormonal states like menopause, etc. Hormone associated nocturnal cardiac irritability is seen in Spongia, has links with menses related palpitation, and this rubric links to this special kind of background pathophysiology. Now again we will like to go further for differential diagnosis or certain remedies. We have aconitis, very important remedy, but please remember here sudden violent panic, fear of death, heat, worse, more febrile states almost during fever, worse around midnight but not excitement and not dryness. These are the things which eliminate aconite. Cactus grandiflorus is one of the important remedies. We have to differentiate here. The feature of angina is like band around the chest but more congestive, pressive because of venous stresses, and there is no dryness, no grasping, no sawing respiration. Or let us go to arsenic album. Here condition is worse after midnight, anxiety and suffocation is there. but with burning pains, restless edema, and thirst for frequent small sips of water is characteristic. We go to the legacies. Here again we find nocturnal aggravation, choking on falling asleep, more left-sided, congestive and pulsating features are there. And the last, what we have been reading is Spongia, which is a unique dry respiratory tract, cardiac constriction, grasping after midnight pains. That seals the diagnosis. Friends, thank you very much for your patient listening and watching. I hope you might have liked this, and I hope this is going to help us in understanding the pathophysiology of Spongia. With this, I end here. Thank you very much once again.